all of those studies are epidemiological studies. They're population studies that were created by CDC and the vaccine industry. They're either overtly fraudulent or they have been disavowed by their own authors, and yet they're still on those websites. The studies I'm talking about are not on the website. You're saying that
they're ignoring them?
So I think what we're getting to is, let me get to this, Dr. Jane. I think what Robert Kennedy, I think what Robert is saying is that the CDC is putting out fraudulent information.
Right, and here, if you look, this is a book that I wrote, where we spent 3 years with a dozen of the best scientific researchers in the country, and we went through PubMed, we went through the entire public medical literature, we found every study ever done about thimerosal, and we put it in here.
Okay, then let me let him answer then. Robert, if you would please, let me let the doctor answer, please, because I want to make sure he gets the time in here. So, doctor, we're talking about the CDC basically handing out fraudulent information, and Mr. Kennedy's own book, which he is promoting, which then points to exactly what he believes the studies are that says the CDC is lying.
So I'd like to ask one question. Are you saying that the CDC is intentionally ignoring the studies that you've researched?
Now,
yes,
Robert, did you hear that?
Saying that yeah, I'm saying the CDC is intentionally ignoring those studies, and I'm not the only one saying this. The chief scientist of CDC, Dr. William Thompson, who is still at CDC and who is the primary author of 2 of the 3 American epidemiological studies cited by CDC to exculpate thimerosal, Dr. William Thompson, in August, invoked federal whistleblower status and turned thousands of pages of documents over to Congressman Richard Posey and has asked to be subpoenaed before Congress because he believes that he and his division are at least partially responsible for the autism epidemic in this country.
Okay, let's stop there, if you will, because I'm short on time, Robert. I have to make sure that I get the doctor's answers in here. So, doctor, from the medical standpoint,
he has been ordered to lie.
Do you, as a medical doctor, then believe that you're being lied to by the CDC and that there is still a danger and a connection between thimerosal/vaccinations and autism?
As a doctor, I don't feel I'm being lied to by the CDC or any of the organizations. And so I really want to say that as a physician, you know, we put a lot of faith in these organizations to do the research and not to ignore anything out there. So if there's a legitimate research study out there that's proving what Mr. Kennedy is actually saying, it's their responsibility to look at that. And I find it very unusual. It doesn't make sense for any organization that's in the interest of public health would intentionally ignore something like that. That's where I'm having a problem with that.
So what would you then consider, doctor, to be a legitimate source of information that you rely on in this case?
So, you know, there's a lot of information, there's a lot of studies out there, a lot of the information out there is legitimate and illegitimate. You know, multi-center, double-blind, you know, these evidence-based medicine is the biggest way to, you know, in terms of legitimate data. So the studies that are being mentioned, I don't have a clue in terms of who these institutions are. Is it Mass General? I mean, who are these institutions that are doing these studies?
All right, let me do this.
I want to know the legitimacy behind it.
Okay, I got about 30 seconds
I'm happy
left.
to answer those questions.
Robert, I got 30 seconds left. What about the legitimacy of these studies?
There are literally hundreds of studies by independent scientists and by CDC, FDA, and the big universities and medical institutions in this country that show that thimerosal, which is a potent neurotoxin, 50 times more neurotoxic than the methyl mercury in fish. Why would we inject that into a child?
But it hasn't been injected into anybody in 15 years.
No, I just explained to you, it's still being injected to people every day in the flu vaccines in this country.
Okay.
Into children in every year until they're every year of their lives from 6 months on, and to pregnant women.
We need to follow up more on this.
Why would you inject a neurotoxin into a pregnant woman?
We need to follow up more on this.